Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths, as well as the author of Migraines and Epilepsy, You Are Not Alone. And while we're talking about the brain, I'm going to point out a particular study looking at head trauma and something that can potentially help with head trauma. Being a chiropractor in practice, seeing patients that have been in car accidents, head trauma is not uncommon. We don't even have to hit something with our head. It can bounce off the headrest. Concussions can occur with striking soccer ball, another person's head in sports. All kinds of things can create head trauma. Been in the martial arts for almost 30 years. Lord knows I've seen my share of head traumas. So when head trauma becomes an issue, it's not uncommon for things like balance and headaches to occur after head trauma. And these can be very significant and impact quality of life while those symptoms heal, which they typically do. There are cases where we develop post-concussive syndrome and those symptoms will not go away on their own. So what can we do about this? I mean, there's certainly a long list. I've written lots of stuff about what to do after concussion or head trauma to protect your brain from the damage that can occur. But this particular study looked at a treatment done. Now, as a chiropractor, I would also disagree with the treatment done, but it wraps into what a typical chiropractor does in their office. And this had to do with nerve blocks. So injections in the suboccipital occiput is the region of the brain, sub meaning below, so the region just below this ridge on your skull. Injections into there helped with pain and balance. A little surprising about the balance aspect, but I guess if you really think about it, how much input we get on balance from our neck and especially this region of the brain is not that unusual. So obviously as a chiropractor who does a lot of soft tissue work, this is an area of the body that we treat all the time. Headaches we see frequently and generally do very well in the office. So part of the treatment plan for anybody who's had head trauma, especially headaches and potential balance problems, is going to be working on the muscles as well as adjusting that area. So while this study looked at nerve blocks to help with balance and pain, it would make sense that what a chiropractor does would also have an impact on balance and headaches. And clearly that's what I see and have seen in 20 plus years of practice, that people with head trauma who have headaches, people who haven't had head trauma and have headaches, and people with balance issues can do very well with chiropractic care. My bias is to also treat the muscles in that area. It makes adjusting a much different story. And you're addressing the entire motor component, not just the joint, but all the muscles and the ligaments and the fascia that surrounds that. So as always, I'll post a link to this particular study in the comments section. Make sure you share this video with somebody who's recently had head trauma and wants to know what to do about it. And subscribe to the channel.